name is Hilary Vandergooten. I'm the clinical coordinator for the new emergency project. I'm also a patient care coordinator in our current Emerge. And joining me today is George Codry, the senior project manager from Fraser Health.
Together we're going to take you on a tour of our new emergency center, generously supported by the Martini family. As we get moving through the emergency department, we're going to share the progress made to date, tell you a little about the advanced technology that goes into a building like this, and show you how your support is going to make care better for everyone that comes through the doors. So come on, let's get started. So here we are in the patient and family arrival area. This is the first stop for most visitors to the emergency department, and this is generously supported by the Skidmore family. Within these walls are over 49 treatment spaces, up from our current 31 treatment spaces, including stretcher bays.
They're divided into 5 separate zones: acute, subacute, minor treatment, pediatrics, and mental health and substance use.
Each zone is specialized to meet the needs of the patient, but together they meet the needs of all emergency department patients.
The first stop for patients who arrive to the emergency is the patient check-in area. This area was generously donated by the Langley Memorial Hospital Auxiliary, and the space is big enough for family members too. On arrival, patients simultaneously receive registration and rapid assessment and quickly move to the appropriate zone waiting rooms. This is a patient-focused approach, different from our current emergency.
Over 24% of our patients arrive by ambulance and come in through a separate door from the pedestrian patients who use the main department doors. While our current emergency department has no dedicated ambulance bay that can provide paramedics quick access or best provide patient privacy, our new emergency department will have a dedicated covered ambulance bay with parking for 6 ambulances.
Stretcher bays here will accommodate ambulance arrival, and a separate workspace for paramedics, RCMP, and clinical staff will decrease the congestion in the main entrance, improving clinical workflow. Alcoves built for special equipment like portable x-rays can be easily accessed and brought to the patient's bedside based on their medical needs.
The center also has wireless technology that helps staff immediately access diagnostic information such as ECG or x-rays and have access to the patient information system.
I'm standing in the future care station of Zone 1, generously supported by Ann Blau. We have 3 separate care stations spaced out evenly throughout this zone. This allows for staff to be closer to the patients for monitoring and have easy access to equipment. In here we have 2 brand new trauma bays, close to the ambulance entrance and to the main check-in. It also could be expanded to accommodate up to 5 patients in a mass emergency. Large exam rooms in Zone 1 allow not only room for their patients and their family, but also for the medical team and any necessary medical equipment.
Each room has a medical head wall, which has suction, oxygen, cardiac monitoring, and each space will be single occupancy, which improves infection control and patient privacy. This dedicated corridor allows staff to transport patients to and from medical imaging and brings in a lot of natural light to improve patient care. Wayfinding can be difficult in any environment, especially one as complex as the emergency department. We built this corridor to improve wayfinding and simplify it for patients and staff.
Welcome to Zone 2. This zone primarily sees less urgent emergency patients. We see patients with cuts, broken bones, abdominal pain, nausea, vomiting, and mild asthmatics. It's primarily for patients who do not require cardiac or respiratory monitoring. We even have a room dedicated for testing where ECG and lab tests can be done prior to the patient seeing the emergency physician. After ECG and blood test results are in, patients will be moved to a stretcher bay to be examined by the ER physician. Once the examination is done, patients will be moved to a chair bay for further treatment or examination. This frees up the stretcher bay for the next patient.
Designing both stretcher and chair bays provides more efficient use of space in the emergency department overall. This zone has a good mix of both types of spaces. Stretcher bays allow plenty of room for patients, family, and staff. And it'd be nice to know that in our current emergency department, our largest space is smaller than our smallest space in our new department.
Looking into Zone 3, our minor treatment area. This area has been generously supported by Manjeet and Darcy Gill. Here we see patients requiring stitching, burn treatment, treatments for localized infection, and pain relief. Patients rest comfortably in the recliner chairs while awaiting for treatment. This area also has 7 treatment spaces, up from our current 2.
Zone 4 is for our pediatric patients and is generously supported by the Eric Woodward Foundation. Zone 4 has a separate waiting area so that children feel more comfortable and rooms that are large enough to accommodate family by the bedside.
There is even space for specialized pediatric equipment to meet the unique needs of children in varying sizes, from small babies to tall 6-foot teenagers.
Our last zone meets the needs of our mental health and substance use patients and is generously supported by Barb and Phil Jackman. This space features less medical equipment and more meeting space and is secure and more welcoming for the patient.
A quiet and low stimulus lounge area with lots of natural light provides a calm environment for the patient waiting for assessment. Some patients avoid coming to the hospital because they're afraid to leave their belongings. We've provided secure and private lockers for the patient's belongings to be locked up so they can seek the treatment that they really need.
All in all, our new emergency department will be about 3 times the size of our existing department, with plenty of room for loved ones to stay with patients, and each space will be specifically designed for both patients and caregivers.
My team and I are excited about having enough space, the right space for the current population. This will allow us to provide great and compassionate care that already happens in our department. We can't wait to welcome you for an in-person tour when the time is right.
And as you can see behind us, our new MRI is taking shape, and we look forward to the day when we can show you Langley's first MRI project.
On behalf of the emergency team and all the other departments that provide care, thank you for making our dream a reality.